Okay, first and foremost, how many of you truly want to restore your health back to normal? And how many of you truly want to enjoy your health right through the time that you are here on earth? Yeah. So, yes. So, if you say you are, then I want you to type out in that chat box and just say yes. Let's have you be a little more interactive. Yes. So, I want to thank each one of you for taking time out and being a part of this webinar. We are doing this for the first time, and we'd like to thank you all for being a part of this. We'll have a lot more webinars. I have a series of 5 webinars. This is the first one, and this is titled Restoring Your Health Part 1. So we'll have 5 parts to this, and each time we'll discuss one very important pillar of restoration of your health. But before I get there, I'd like to introduce myself to you for those of you who don't know me. I am Dr. Lenny Da Costa, functional medicine expert. I've done my MBBS, I've done my geriatric medicine post-grad and fellowships in functional medicine and mental toxicology. And I've been treating heart patients using alternative allopathic medicine, or what you would call functional medicine, which is now called functional medicine rather. And I've treated over 25,000 patients till date. Very, very, very successfully. I have a lot of patients who come back to me and thank me for being able to, so those of you joining, thank you so much for joining. I was just introducing myself. I have been in this field for the last 25 years, the last 17 years, treated over 25,000 patients. And today, my main reason for doing what I'm doing is because I want to get as many people, as many of you, knowing what functional medicine is all about. I want you guys to understand why is it that we get chronically sick much earlier. And my driving force, so the reason why I do it, and the reason why I want you to know all this, is primarily because I want all of you to take your health into your hands. I want you to take restoration of your health into your hands. And therefore, keeping this in mind, I've started the series of webinars where I want to teach you how you can, with the help of your doctor, actually take charge of your health. If you understand what's going on, you know where to intervene, what you want, and what are the outcomes you're basically looking for. So with this introduction about myself, oh yeah, I forgot to tell you that we do a lot of cancer patients now as well, and done over 4,000 cancer patients with high-dose vitamin C. Treated a whole lot of patients with even stem cells earlier on in my practice. I still use them wherever needed. But my practice more is now towards cardiac cancer and aging populations, where we want people to actually live a good quality life as they age. And primarily, we'll want to look at young individuals, young professionals, and prevents them from getting sick early, because this is something that you can prevent. And as long as you can prevent this, you will definitely do well going forward and ensuring that you have a good, healthy life. Having said this, do you think you would want to take care of your lives and align yourself with what I have in mind for you? If yes, please say yes in the comment box. I'd like to see you interact. Please just type out yes. Thank you. Thank you. Thank you. A lot of more people still joining. I know normally we are a little slow, and therefore I've really not taken off. So today I am going to be introducing to you the 5 pillars of functional medicine. We will go and touch upon every one of them, and we'll try and understand what each of these mean for us. Okay, we'll take this forward and then understand how we can actually look at using this knowledge in actually taking care of our health and restoring our health. Yeah. So I think it's time to get started. Okay. So my dear friends, with the knowledge that we'll live longer than those before us comes the quest to live better than those before us. Will we be in a wheelchair with scarce recollection of our past, or will we be? So we need to understand whether we will be in a wheelchair when we reach, when we become older, or are we going to be in a chair with scarce recollection of even our name? And that is what is happening in most advanced populations across the world. You see people with Alzheimer's. In fact, today, with the current problem of COVID-19, we have seen a whole lot of populations in Italy, in Spain getting wiped out. Why is that? Because more than 90% of this population that was getting affected were people who were stuck in their wheelchairs, having lost their memories or pre-Alzheimer's or senility setting in very early, maybe 65, 70. And these are the people who got affected first in the first wave of COVID-19. Why does that happen? It's because we have aged pretty fast. And therefore, the question is always, will we be in that situation? Or will we be walking, talking, energetic, and happy? So is it the time that we live here that is more important to us? Or is it that we live well as long as we live? Is it that, we can enjoy our lives rather than just live? Because if you want to live, anybody can live. Even if you can't walk, you can be put on a machine and you can remain in bed with artificial respiration. Is that the quality of life that you want? Or do you really want to have a happy, disease-free, productive life? And if you want to do that, you need to allow your body to do what it does best, keep you healthy. Because finally, no matter what medicine you practice, what medicine you use, what I give you, or what medication you take, or which doctor you consult, the best doctor to take care of you is your own body. And unless you take care of that, you will never, ever be able to get back to good health on your own. So whether you call it anti-aging, preventive, regenerative, restorative, or functional medicine, this is no myth, because a lot of people have been talking, saying that this does not exist. My dear friends, this is the only way forward to complete wellness. I personally have seen it in tons and tons of my patients, where they have reversed disease because they have gone into proper restoration of their health, and using these 5 pillars of functional medicine, they have been able to do what nobody else does for them. Yeah. So going a little deeper into this, the last 2 decades, my dear friends, in medicine proves that when you apply this form of medicine, you get 90% resolution in most of your symptoms. And what are the symptoms that most of you or most of the patients go? What are the symptoms that affect you, where you really shift from one doctor to another because you don't get answers? These are the symptoms that get corrected when you apply this genre of medicine, or this type of principles of medicine. And you do get results. And the symptoms are simply fatigue. There are so many patients who come to us for fatigue. Tons of you have insomnia. There is decreased libido. In Bombay, I've been having young patients who come to me and saying, listen, I have erectile dysfunction. What can I do about it? Then there is a whole lot of people who come for weight gain. Today, weight gain is $1 billion industry. People want to lose weight. And right from getting portions that can get you to exercise, the way of life, everything has been affecting you, or these are some of the things that do keep coming up regularly as far as weight gain is concerned. And people go for anxiety and depression. In the US, antidepressive drugs are the second highest sold after cardiac drugs. So you can imagine how bad depression is. And finally, of late, I have seen so many young patients in the age group of 35 and 40 who come to me with joint pains, uh, with knee joint problems, with meniscus tears, and so many other things. And finally, I have seen so many young adults, aging adults in the age group of 55, 60, who say, I am losing my memory. Why is this happening so early? And none of this has any results that you get or any solutions that you get from modern medicine today. And therefore, looking at functional medicine, many of these people have been able to reverse these symptoms. And there is an 80% improvement in disease states like fibromyalgia, rheumatoid arthritis, chronic fatigue states, or chronic fatigue syndrome, gastroesophageal reflux or GERD. This is the commonest complaint that I get in all my patients. Something or the other, they say, we've got acidity. It's not acidity. There are so many other things that lead to this. Then you have the gastric reflux. You have IBS, that's irritable bowel syndrome. You have high cholesterol, which most people come up with. Really, whether high cholesterol is something that we need to look at. You have IHD, you have blood pressure problems, you have PMS, and many of these, including polycystic ovarian syndrome, which majority of the patients don't get relief from their gynecologist, can be sorted out with this kind of principles of medicine. And finally, you have infertility, sleep disorders, anxiety, and ADD. So these are other conditions that we do get good results when you use functional medicine to treat them. So finally, when we look at this, this is one of the reasons why generally you have a lot of people looking and searching for practitioners of anti-aging medicine, functional medicine, or restorative medicine. That's the quest for this kind of medicine. So functional medicine or anti-aging medicine or restorative medicine, my dear friends, applies to advanced technologies for very, very early detection, prevention, and reversal of age-related disorders. And this is one of the basic, functional, key, foundational stones of this medicine, the basis of how this medicine is practiced. The reason, the thing that we do is we look forward for early detection and early reversal before even your symptoms start showing. This can be done by ordinary blood tests. And as we go through this series of webinars, you will understand how easy and how simple it is. So thus, there's a growing body of data supporting whether this medicine works or it doesn't work. And I've just put one or two studies for you. The first one talks about how women who received bioidentical natural hormone replacement after menopause were able to reduce heart attacks, strokes, bone fractures, and Alzheimer's. I mean, this is not something that I'm just making up. These are studies done. This was published in the European Journal of Anti-Aging Medicine in 2006. My dear friends, 90% or 100% of what modern medicine practices comes from such published data that is available in modern medicine. You have men receiving hormone replacement therapies when their levels are low, who have reduced heart attacks, strokes, and risks for Alzheimer's. I know that I have used a whole lot of hormone replacement, especially testosterone, for males who have had heart disease and very advanced heart disease, and they have reversed because of the hormone. And many a times there has been a lot of misconception about this, and we'll discuss this a little later. So I put about two studies from the same journal which talks about this. Then I have given you Clinical Endocrinology and Metabolism in 2006, which talks about men and women, in both men and women, sexual function improves sharply after restoration of normal levels of testosterone, DHA, and nutrition. So imagine nutrition plays a huge role today. Unfortunately, we have not given it much of importance, and that's why we have so many problems. Again, another one which talks about growth hormone being very important for speedy recovery of musculoskeletal and surgical injuries. Now, I have used growth hormone not in this country, but outside this country, even for people to get quick recovery from paralysis due to stroke. There are tons of patients who have benefited from that, and there are enough and more studies to show you that it works. Now, finally, after you see this, the first question you need to ask yourself is anti-aging for me? Let's look at the reality of what happens today. At the age of 50, You still have your best years of your life ahead of you. And you have really worked hard to reach where you are. At the age of 50, you have succeeded in whatever you want to do. You have the money. Your family is doing you well. Your kids have been well placed. They've got their jobs. Probably some of them are married. But are you living the quality of life that you wanted to live? Because you now have the money to do whatever you want, except the fact that every doctor you go to tells you, you can't eat this, you can't eat that, you should be doing this and you should be doing that. And you're taking these many pills. So is it the life that you want to live? What is your current medical standard? If you have high blood pressure, the tablet that you get is an antihypertensive. If you have a heart attack, what do you do? An angioplasty or a bypass. And finally, when you have a cancer, if you ever have one, if you ever get any, you will be given chemotherapy. Have you seen any patient actually get out of this by taking these medications or these solutions? Does an antihypertensive pill actually get you to become perfectly normal and get rid of blood pressure problems completely? Does your bypass or angioplasty actually get you out of heart disease? Or you get it after a couple of years again? Does chemotherapy really get rid of cancer? I mean, why aren't they working? Because once the bypass is complete, once the cancer is removed, you are still not actually taking care of the underlying cause of this problem. What are the imbalances that allowed this plaque in the first place to get started, or what are the imbalances that have allowed this cancer to develop in the first place? This is very, very important. Please understand, most of the treatments that we do for chronic disease today are treatments which we call band-aid treatments. You're only taking care of a small problem, and the problem is getting rid of that symptom. You are not taking care of the actual problem, which is the underlying imbalance. So given the choice, would you not choose to restore optimal function and prevent the recurrences in future? So if you so far resonate and understand what I'm trying to say, let's have you say yes in the comment box, please. Thank you, thank you, thank you. So would you not choose to live well, walking, talking, strong and energetic, rather than in a wheelchair, not knowing your name? My dear friends, to live well, you need to restore the balance. And this simply means optimizing the ability of your cells to do what they do best: keep you healthy, keep those cancer cells at bay, repair those arteries that are damaged daily. So finally, it is your own cells in the body that are going to keep you safe, keep you healthy, keep cancer at bay, keep the heart disease at bay, keep the hypertension at bay. What does it involve? This involves 5 main actions. 1, correcting your hormone deficiencies. 2, ensuring good and proper supply of nutrients, so good nutrition. We may be eating, but we may not be having the best nutrition. I'll come to that. 3, removing toxicities, especially heavy metals. We know very little about it, and the first question I get from my patients is, where are these heavy metals actually coming from? Difficult for a patient to understand, but for us, we can easily tell you where, and I will come to that a little later. Maintaining mental peace. Ayurveda talks about it, but we don't bother to look at it in modern medicine. Somehow that plays a huge role in the way our disease processes work. And especially as you age, number of them are directly related to the way your mind works. And finally, maintaining a body which is pain-free and structurally strong. So these are the 5 basic pillars which actually help you to maintain good health and restore your health, reverse disease, live a longer, healthy life. All disease is manifestation and imbalances in these 5 areas rather than just one cause. And let's look at it. If you look at weight gain, it is a result of imbalances in hormones. So which are the hormones involved? You have insulin, thyroid, cortisol, estrogen, progesterone. It is the imbalances of nutrients. So you have hormones which are imbalanced, you have nutrients, mainly that activates fat breakdown and muscle development. You have toxicities that are involved, especially metals and acidity prevents the release of fat. And then you have stress, which is very, very, very dangerous for weight gain, causes a lot of weight gain because of cortisol release, and this increases fat storage. So again, see, there are all 5 elements involved. You have hormones, you have nutrients, you have toxicities, you have stress of mind. Also, if you don't exercise, you're naturally going to put on weight as well. So all 5 areas which we just spoke of are associated with weight gain. Let's look at cognitive decline that we see in a lot of our elderly patients. What is cognitive decline? Cognitive decline is suddenly losing your memory, suddenly not remembering what you're doing, suddenly feeling a little out of place, suddenly getting a little bit of what they say, chakkar aata hai in Hindi. It's very common in a lot of our populations that we see this, and it sometimes happens as early as 55, 60. I have so many patients who come to me with this. Where does this come from? This comes from, again, hormone deficiencies, nutrient deficiencies, toxicities, as well as stress and lack of exercise. Bone decline. Again, this is caused because of deficiencies of hormones. Progesterone, estrogen, testosterone, growth hormone, all are involved in this. You have nutrients, low calcium, low magnesium, low vitamin D, boron, all are responsible for bone decline. Toxicities like overload such as acidity, heavy metals, bowel toxins also prevent the absorption of nutrients that are required for bone health. So whether we aim to cure or prevent a symptom or a disease, these 5 areas must be addressed. You need to have a healthy enabling mind. You need to correct the deficiencies of hormones and nutrients, remove toxicities, and get a body pain-free and strong. By re-establishing this balance, we achieve optimum cellular function. So the cells do what they do best, what they do daily for you. They strive to do this, and that is to keep you healthy. So let's go through all these 5 areas and understand why we need to restore it. Okay, so I'm going to give you some very basic facts for both men and women in restoring of hormones, and we'll go to each one, including nutrition, in the next half an hour or so, and I'll try and cover every one very briefly, and then we'll have a longer session in our remaining webinars. So to start with, we age because our hormones decline. And it's not the other way around. It is not that our hormones have gone down because our age has gone up. No. Our aging process, our body's aging process starts because our hormones have gone down. So in men and women, hormone imbalances today start from the age of 30 onwards. Even 2 decades ago, these imbalances would start at about 50, 55. Today, they are starting at the age of 30. And that is the reason why a 35-year-old has high blood pressure. That's the reason why a 35-year-old has diabetes. When you have high blood pressure and diabetes are the first signs that your aging processes have started. By the age of 50, we are approximately 50% of the hormone function of estrogen, progesterone, testosterone, thyroid, DHEA, melatonin, and growth hormone. Pretty much every hormone is involved here. So you are going to live to be 80. 30 years of your adult life, you're going to be living with less than 50% of the hormones that you're supposed to have. How are you going to be possibly healthy? I mean, logically, it's not possible. So you need to understand this cardinal rule, number 1. Unless you balance these hormones, your chances of living a normal, healthy life are going lower and lower, primarily because this is exactly what is happening in our bodies today. So how do you restore hormones? And let us look at this. So one of the reasons why you want to restore hormones is because you want to elevate the symptoms with which you are suffering. Symptoms are simply what you can see. Things like your mood, things like sleepiness, things like high blood pressure, pain in the chest, exhaustion, fatigue. These are the symptoms that you go to the doctor with. this is what you want to get rid of. So one of the primary reasons why you want to restore your hormones is to get rid of these symptoms, because many of the symptoms, they may go off today and tomorrow with a pill. The moment you stop that pill or that medication, you are again having those same symptoms. But the more compelling reason why you should be restoring hormones is because it has a potential of the disease actually advancing and becoming a purely degenerative disease, which it is in the first place. And then once it starts degenerating degenerative changes in your body, it is difficult for us to reverse those degenerative diseases. And that is one reason why. And what I mean by degenerative diseases, where the function of your body starts going down. And that is the reason why it is compelling that you need to restore hormones. Studies have shown that every cell in the body has a receptor for thyroid, estrogen, progesterone, and testosterone. Estrogen, progesterone, testosterone are sex hormones. We think they only work on the sex organs. No. Every cell in the body has got a receptor for it. If it has got a receptor for it, that means it works at every level of every cell. And therefore, you need to understand that every heart cell, every nerve cell, every bone cell, every vascular cell, every skin cell has a receptor for these hormones. And if these hormones are less, then the functioning of the cells also decreases. And if the functioning of the cells decreases, your overall function of that system, whether it's the cardiovascular system, whether it's the nervous system, whether it's the renal system, whether it's your skin, all starts, or gastrointestinal system, all starts decreasing in its functionality. And that is when you start getting the symptoms. So you need to understand, just question, if my basic functionality has gone down, how is it that a pill will solve the problem? How is it that a medicine or a surgery will solve the problem? Unless that pill, that medicine or that surgery will restore that function, will restore that ability of my body to do what it's supposed to do. So you need to understand that to restore it, you have to go and see why. Let us look at a car. If your car doesn't have petrol, it will not run. If it doesn't have oil, it will not run. So unless you put that oil in that car, unless you put that petrol in the car, only then it will start running. It's the same way with our body. We need to understand what is it that is hampering and creating the symptoms. What is it that is affecting its normal functioning? If it is the hormones, they have to be restored. So it becomes clear as hormone levels decline, so will the stimulation to the cells. As stimulation declines, I've just said this, it will lead to a whole lot of symptoms. You'll have sexual decline, you have fatigue, anxiety, mood swings, weight gain, insomnia, cognitive decline, every other symptom will set in. But I have seen something far more dangerous in women where they have early menopause or where they have their uterus removed very early. They get degenerative disease like heart disease, cognitive disease, and osteoporosis very, very early in life. Generally, if you're supposed to get heart disease, it was supposed to be beyond the age of 60. Today, you have more than 60% of your patients, heart patients, who are before the age of 50, and sometimes even the age of 45. So it is quite difficult if you do not want to restore your health to kind of treat these disorders going forward, because they keep coming up over and over again. So preservation of your health and restoration of your health depends on how you can restore these hormones to what should they have been in your body for it to have normal function. And that is what we need to do if we need to restore these hormones. Well, to understand it a little better, at the age of 35, a woman starts losing progesterone first, which results to panic attacks, lighter sleep, anxiety, mood swings, fibroids, cysts, both of the breast and the ovary, and then you have heavier irregular bleeding and weight gain. So this happens in most women around the age of 35. Progesterone is also responsible for bone building. So a lot of women start having thin bones around the age of 35. And then one of the common complaints that they have at that time is hot flushes and maybe even a lower sex drive with declining progesterone levels. What happens when you go to a gynecologist? He gives you a chemical progestin sometimes, and that causes a whole lot of side effects. So the side effects are overwhelm the effects, the beneficial effects that it may have. It doesn't have any beneficial effects. So what is it that you're supposed to do? We'll see later. At the age of 45, again, a woman starts losing the second hormone. So it's first progesterone at 35, 45. It's estrogen. And so sometimes you have your official menopause between 45 and 50. That itself is about 10 years earlier. Your body was meant to have menopause after 50, 55. You're now getting it at 45. And it causes a whole lot of other issues for women. So what happens is, what is the risk that is involved for women when this happens? Most of the women are protected as long as their hormone levels are good. They don't get heart disease, they don't get blood pressure problems, they don't get diabetes, they don't get osteoporosis, they don't get cancer. But if your hormones are affected, normally after menopause, the risk of stroke, heart attack, and breast cancer are very, very high. Data suggests that the hormone imbalances contribute to breast cancer largely. Of course, there are certain kinds of breast cancers, which are few, which are not related to hormones. Today, we know that as well. But that has got a different etiology, and that we will discuss some other time, not in this series of, because that's an abnormal finding, or it's an abnormality, or there's always an exception to the rule. We also know that most breast cancers occur after menopause, precisely at a time when the ovaries stop producing normal balance of hormones. And therefore, this is one indication that if you restore hormones, you may prevent cancers in women. So why is it so important? See, first, the progesterone, which is, I told you, it declines at the age of 30, 35. This actually prevents what we call cell. I'm going to give you this a little in brief, because this is meant for a medical audience, but I'm trying to tell, this is meant to try and teach a lay audience what basically happens and how your hormones work. Progesterone, which is a hormone that you normally see in large quantities when you are pregnant, when a woman is pregnant, it prevents breast cell division. Why? Because it needs the breast to give a lot of milk for the newborn baby. It's preparing for that. Progesterone saves you from any kind of breast cancers. That's the natural progesterone. Now, progesterone slow down or decrease in quantity from 35 onwards. What happens there is, the other hormone, which is estrogen, which is present in your body, is supposed to increase breast cell division naturally. That's its job. So that is in excess. So you start having an unnecessarily increased breast cell division. Now, 10 years later, you have an imbalance of estrogens. Now, estrogens, there are 42 estrogens in a woman's body, of which the three are most important: E1, E2, and E3. E2, E3 are the good ones. So E2, which is breast and clot protective, decreases from 80% to 10% when you start going towards your menopause. And estrone, E1, which is bad and is responsible for breast cancer, goes up from 10% to 80%. So this is the other thing that happens in a woman. There's an imbalance of the estrogens as well. And this increase is an undesirable increase. This gets converted into carcinogenic forms of estrogen, or E1, which are known as 16-dihydroxy-E1. I'm not getting into the technicalities, but just remember this, that E1 is, if it starts rising, your chances of getting breast cancer are much higher. Unfortunately, we can't actually go and test this in India. Overseas in the US, they still have this testing available. In India, it's very difficult to get this testing. So if you restore the protective hormone levels needed, you will immediately start preventing the chances of you getting breast cancer. This is one basic thing that you need to understand. And there are ways that we do this. This is what we call hormone anti-aging medicine, or hormone replacement, or hormone balancing. I've been doing this for the last 15 years. A lot of women have benefited from this. They live a happier, more fruitful, more healthy lives than ever before. Most studies show when you start hormones early, that means when you see the imbalance early, when the patient comes to you with very early symptoms of mood swings and sweating and things like that, the effect of protection against heart disease, against cancer, against brain fogging are huge. Progestins, which are basically chemicals, which are chemical hormones which are made by pharma companies today, they have the same side effects which progesterone is supposed to protect you from. Why is that? And breast cancer is caused by them. Why is that? Because progestin is seen as a foreign body by the body. It does not recognize it. It is different from a normal progesterone. See, progesterone is a chemical structure. That chemical structure the body has to recognize. If it doesn't recognize it as that, it will throw it out. It will not allow a unrecognized substance to go and work at a particular spot. It's very simple. If you get somebody to your door, knocking at your door, and you don't recognize him, you will shut that door. This is the same way every hormone acts. It has got what is known as receptors. These receptors are doors. They can enter your cell through that receptor. Those are doors, but those doors will not open to you if it doesn't recognize you. Progestins are foreign bodies. They're chemicals. These progestins are not recognized by those receptors, and therefore you have side effects of them. And therefore what you need to do is have what is known as bioidentical hormone replacement. What are bioidentical hormones? Bioidentical hormones are hormones that are made in the laboratory, in factories, but they are chemically exactly identical to the way the body makes the hormone. So if it's estradiol, it will be exact match, atom to atom match for it. If it is progesterone, it's an atom to atom match. So if you look at that, then only will they work well. So when you're restoring hormones, you need to know that you are actually using protective forms and good forms, and the delivery routes have also to be correct. Now let's look at testosterone in men. I've just finished with women. This testosterone declining in men is supposed to be one of the most important things that happen in men as far as early aging is concerned. This starts happening at 30, late 30s today. I have seen people even in late 20s having testosterone declines. So the desire for sex goes down, joint and bone pains come up, muscle weakness is very common, loss of confidence, moodiness, depression, anxiety, muscle loss, and fat gain. One of the major signs that you're suddenly putting on weight could be that your testosterone has started declining. So always remember, whether it's a male or a female, if you start putting on weight, that weight gain is the first sign that the hormonal imbalance has started. That is your first sign. Don't wait for other problems to start. Go and check. There are tests that we do which can decide whether you are going down that lane of actually becoming or aging early. Are you getting this? Please type yes if you're getting this, because it's important to understand this. Weight gain, the first sign. Testosterone restoration in such males who have these symptoms do not only address the symptoms, but studies show that it has a protective role in heart disease, in cognitive decline, and in bone loss. I have seen patients really, really do well when they actually start taking testosterone supplementation. The risk in men, traditionally, testosterone restoration was thought to be associated with heart attacks and prostate cancer. Now, I want to explain this a little to you because many doctors would say, no, if you take testosterone supplementation, you'll get prostate cancer. Please understand one thing. If this was the case, then a 20-year-old should have died of prostate cancer or heart disease. Why? Because he's got the highest amount of testosterone in their bodies. The testosterone level of a 20-year-old is much, much higher than anything that you can create in a 40-year-old or a 50-year-old for him to get heart disease or prostate cancer because of that. What basically happens is when you start aging, and if you have got too much of fat in your body, there is something known as aromatization. It is your testosterone getting converted into the female hormone estradiol. This happens in your own liver. That is when the problem happens, that your prostate levels go up and you can have heart disease. Because if your estradiol levels start going up, that is when the problem starts. So when you give testosterone supplementation, we generally keep a check on your estradiol levels so that this transfer does not take place and you are not harmed. Also, certain nutritional supplements prevent this from happening. And this was proved by the New England Journal of Medicine in 2004. And today, all cardiology literature, all cardiology books do show that maintaining good level of testosterone in the upper ranges of normal lower the risk of cardiac problems for patients, especially males in their late 40s and 50s. Higher your testosterone, better your body strength, good exercise levels you will be able to do, and you will prevent heart disease and neurological events like stroke, as well as high blood pressure, and even to some extent diabetes. Now, when we look at other hormones besides these two, I want to just talk briefly about thyroid. There are so many people who come to us with thyroid. Please remember something. When you have low thyroid levels, the first thing they give you is something known as thyroxine, which is T4. My dear friends, there are two hormones in our body, two thyroid hormones, T4 and T3. T4 is the inactive form. T3 is the active form. T4 needs to get converted into T3. For T4 to get converted into T3, you need zinc, you need iron, you need selenium, and you need iodine. Without any of these, the conversion does not take place. All these four act as what we call cofactors. Any decrease in these also does not allow T4 to get converted into T3. So when you have low thyroid levels in your body, if the doctor is giving you T4, which is not converting into T3, which is how it has to, in what form it will act on your body, what is the point? Please think about it. So you need to look at T4 and those cofactors that will help the conversion of T4 to T3. So if you are taking, let's say, thyroxine, you also need to take zinc, selenium, iodine, and others, which will help this conversion very easily into T3, which is the active form, and which then acts on your body and helps the thyroid to do what it's supposed to do. Otherwise, there's no point taking those thyroid hormones. Yeah. And then you have insulin. Generally, when insulin goes up, you have insulin resistance, you start putting on weight. So with weight gain, you have areas of fat. So when your insulin is high, your sugars are high, you start putting on a lot of weight. If your sugars go down, you start going into what is known as hypoglycemia. This insulin, you need to really take care of it. There are ways. Recently, I came out with a video called intermittent fasting. One of the best ways to get your insulin resistance down and insulin sensitivity back. Also, good amounts of exercise regularly. I'm saying not walking, exercise, and I'll come to exercise in this session, will definitely help you reduce your insulin resistance. Please remember that. Okay. So in a pre-diabetic state, cardiac risk is high. Any high insulin in your body gives rise to high heart disease risk. Any high insulin in your body gives rise to sugar cravings because your glucose also will be high. When it is low, it gives you dizziness and headache and sweating. The metabolic imbalance is effectively addressed by hormonal and nutritional restoration along with clearance of toxins. And you must understand that if you don't give proper nutritional supplements, you don't exercise, and you don't remove toxicities from your body, the chances of insulin resistance going down are next to nil. One reason why 90% of our diabetics are constantly on drugs and they keep increasing their drugs because they cannot control the insulin resistance in their body. And that is one reason why diabetics keep getting problems every year. Their medications keep going up and up and up. It's sad, but that is the way our patients are treated, or all of us get treated, without understanding why this is happening. So unless you understand what is the kind of food that you put in and how you can control these insulin levels, your sugars will never get controlled. Yeah. Then you have other hormones like DHEA, melatonin, pregnenolone, growth hormone. I mean, I'm not going to get into it. You just need to know that each of them also is something that we need to look at. So when we do a blood test, we look at all these and we tell you what you can balance and how you can balance. For example, melatonin is very good for people who get this insomnia, people who can't sleep properly. If I can get your melatonin levels back to normal, your sleep comes back to normal. You don't need to take sleeping pills. So it's such a beautiful hormone. Similarly, there are so many others like this as well. Okay. Now, I'm going to give you a few tips. If ever you go to any doctor, any functional medicine doctor who can actually restore their hormones, and you need to use only the best form of hormones, use only bioidentical hormones. It should always be accompanied by nutrients that activate the hormone receptor or act as a cofactor, and also removal of toxins, which may interfere with the activity of nutrients or hormones. So you must always remember, just hormone replacement will not work. It has to be with nutrition and removal of or detoxification. Hormone function is more important than the hormone level. So you need to understand that while your thyroid hormones may be normal, sometimes they may not be optimal, and that is what we look at when we look at restoring your hormones. Achieving optimal function of hormones is most important. So you need to use different hormones and ensure that the deficiency is balanced rather than use a huge dose of one. There was some people who used to give patients a magic pill of DHEA, which was not correct. Please don't do that. It has to be checked and decided which one, and whatever is low or high, you need to balance it. There is never a magic pill for cortisol and high insulin. Now, why there's no balance for cortisol? Because unless you control your mind, unless you control your stress levels, cortisol will never come under balance. Okay. Now let's go to the second one. We have done restoring of hormones. Let's look at nutrients. Now, I have always spoken about nutrients and nutrition. A large number of my videos are on this. But I always keep telling you that one of the major reasons why we eat well and we are malnourished despite eating well is because we do not get the nutrition from the food that we are supposed to get. Commonest question I get from every person who listens to me or comes to my sessions is, why is it that my grandfather ate the same thing and he had proper nutrition? Why is it that I don't have the same nutrition? And probably it's not probably the one reason and the only reason I can think of, and the only reason that we do not get nutrition is the state of our soil. See, the soil is depleted of nutrition. Why does this happen? We, in our quest for good amounts of electricity all along, have forgotten that the dams that we have built are preventing the nutrition from reaching those soil in the plains where we grow our vegetables, where we grow our fruits. All your nutrients come from the mountains where the river starts and it brings it down to the plains. But when you put a dam, it remains in that dam. It does not recharge the soil. So your vegetables don't have the same amount of minerals like zinc, copper, selenium, chromium, whatever else you can think of, all the magnesium, all these are not there in your soil. So the amount of this nutrition or these nutrients getting into you are far less than what your forefathers ate, what your grandfather ate. So the effect of this nutrition is not the same as what they were getting. They were protected because they had good amount of nutrition coming from the soil. We don't get that. And that is one of the reasons why we are stuck. Then you have a whole lot of free radicals that get into your body for various reasons. And these are, to break them down, you need a whole lot of antioxidants. Where do these antioxidants come from? These vitamins and minerals that are present in the soil. Thirdly, all the fruits that you eat today are not from your local area. These fruits come plucked from a tree when they were raw, because they're coming from faraway places. If they were ripe, by the time they reach you, they would have gotten rotten. So they have to be raw. They reach your place raw. Then they are ripened in a warehouse, either with chemicals or by using colored lights. And these, though they taste very good, they have no nutrition. The third reason why we don't have proper nutrition. Yeah. So what do? So you need to replace your zinc, your selenium, your iodine, because every hormone needs that to be activated. Every hormone receptor, to activate a receptor, you need a cofactor. Uh, for your thyroid to work, you need higher levels of vitamin D. Your insulin needs chromium, vanadium, magnesium, and B3 to get active, and the list can go on and on and on and on. So restoring these nutrients is very, very important. What do you do? That is, look at what we can do. The first thing you need to do is ensure that you have a lot of vegetables instead of frank carbohydrates. Second, use organic fruits and vegetables from your local area rather than getting it from faraway places. Third, use a lot of good oil. Oils are not bad for you, specifically coconut oil and homemade oil, which is the most important thing that you need to use, and homemade ghee. These are the two that you can use because these two help you. What you need to avoid: preservatives in all kinds of preservatives in food, processed cans, specifically in boxes, simple sugars, all kinds of sugars. And when I mean sugars, I'm talking of even the sugars like high corn fructose syrup, which is present in most of your so-called sugar-free juices, and uh, practically every sauce that you get in the market has got high corn fructose syrup. These two are very simple sugars that create havoc as far as your body goes. And stop using every possible oil in the market, because every oil that is what do you call processed oil or refined oils, they are heated at very high levels, and these become trans fats. Specifically, when you look at hydrogenated vegetable oils, every vegetable oil is a hydrogenated vegetable oil. My dear friends, these hydrogenated vegetable oils in the 1920s or or just before that, when we did not have electricity, were used to make candles. They were not meant for human consumption. Today we are consuming it. So think what will happen. The only way that it will do, only thing it will do is it will harm you. So you need to ensure that you don't have these hydrogenated vegetable oils. Then you need to ensure that even though we have the nutrients, sometimes we cannot get those nutrients that are needed for the hormones and the energy cycles to start working, and other pathways to act. So today you need to understand that you need to give a combined thing of all nutrients, not just one. We have a tendency many a times to say, okay, I have a thyroid problem, I'll take only zinc, or I'll take only this. Today, the major thing that is happening with COVID is we'll take zinc only. No, my dear friends, zinc alone is not going to help you. You need zinc, you need selenium, you need that vitamin C, all those three, and you need magnesium. Without these four, you will not be able to improve your immunity. It's just not zinc that is going to help. Yes, at the time of infection, probably zinc is the only one that works. But for the infection not to get into you, you need the others as well. And if the zinc has to work well at that point of time, it needs to work in harmony with the other nutrients that is there. So even today, the American Medical Association recommends that we take a multivitamin, multimineral pill to prevent chronic disease. This has finally happened over the last 4 years, that the American Medical Association today talks of this. There was a time that they used to say that there was no need to take any multivitamin or multi-mineral pill. Okay, so that's as far as restoring is concerned. So I'm going to give you a few tips now. You can always test what are the nutrients that are missing from your body. There are a lot of tests available today. Always look at the nutrient deficiency and look at whether there is a problem with your bowel, because if you have bad bowel problems, it will not absorb the nutrients that you are taking. So if you feel that you need to supplement yourself with good nutrients, you also need to take a good probiotic, either in the form of food or in the form of a supplement. Always remember, look at what is there. There is always inside that pill at the back, it will be written other ingredients. These other ingredients are generally fillers, binders, dyes, and other impurities. You need to have no such things in your supplements, because those are chemicals that harm you. generally. Yeah. Then I will answer this. I will answer your question a little later. Can we hold the questions? Can you write it down? Okay. So oral supplements should be taken in divided doses and at least 2 times a day. Right? Many people are B12 deficient. So if you have a B12 deficiency because of an absorption problem, you cannot keep putting that patient with B12. And finally, the ratio of meals should be 30% of good fats, 40% lean protein, and the balance 30% as carbohydrates. Now, when I talk about that division, it is not just for people who are planning to lose weight and things like that. That is for just maintaining your normal health. If you want to actually lose weight, your carbohydrate level should go to 10%, and you have to have 60% of fats and 40% or 30% of protein. This we will discuss when we do a full session on nutrition. But some other things is you need to have a lot of antioxidants. Superfoods like spirulina do work, especially if you are a vegan, because you need a large amount of protein, and proteins do come from spirulina. You have a lot of red wine, which is good, but I don't advise it in this country, but in some other countries, yes. Some of the best fats come from walnuts, almonds, flaxseed. Virgin coconut oil is the best of all. Homemade ghee is excellent because it actually goes and lines the internal part of your gut, your small intestine, and that helps prevent a whole lot of issues that do take place in a lot of patients, specifically toxins getting into your blood, into your system. So homemade ghee is excellent. The best strategy is to use a range of healthy sources instead of overindulging in any one healthy food. There was a time when people used to say soy is good, so everybody started eating soy. But the problem that most people didn't realize is having so much of soy can also cause health problems. So you need to have not just one food item, but you need to have a healthy range of all the healthy food items, not just one. Yeah. Now we have done 2. We are coming to the 3rd one, and I've still got about 20 minutes to go. I think I'll finish in the next 10 minutes, and we'll have some time for questions. So we are exposed today to toxins more than 50 times the level of toxins any time before in history. In fact, today, if we look at this COVID virus, the most advanced race in the history of this planet has been brought to its knees by an organism that is not even an organism. The virus is not a living organism, but it is the most unevolved of any organism, and it has brought the most evolved species to its knees. Why does that happen? It happens because we have put so much of a load on our bodies. The amount of toxins that enter our bodies is far, far, far higher than any time before in history. You have to look at the kind of water that we drink, the air that we breathe, the food that we eat. Our cell phones are also giving us a whole lot of issues also. These toxins reside in the bowel, the liver, the fat tissues, and they impair the chemical functions that happen, the reactions that happen in the body. You also have a large amount of bowel toxins like candida and other bacterial overgrowth that impair absorption of food and nutrients. So you just don't need to get nutrients. It's not that you don't have to eat. You get malnutrition because you don't have nutritive food. Sometimes it is because of bad absorption, because your gut is not in a good condition. Sometimes your gut being in bad condition or gut issues being there, you can't detoxify yourself well, because detoxification from the liver goes to the gut. Your liver is the most important organ. It takes all the bullshit and throws it out. It throws it out through the gut. If your gut has got what is known as gut problems, then you will never get or never be able to detoxify properly. The electromagnetic radiation from cell phones, computers, cordless phones is terrible today. It is known to have bad effects on the sperm function, on the brain function, the thyroid function, as well as on the immunity of a person. In fact, 5G is today noted to have a direct effect and supposed to be directly related to some of the virus mutations that we have. My dear friends, please don't be under the impression that this is the coronavirus is coming for the first time, or the mankind is looking at this virus for the first time. Coronaviruses have been here since the age of common cold. But this is a mutated coronavirus, which is known as COVID-19, which causes COVID-19. It is mutated. Why does the mutation takes place? Because of the kind of toxins that it is exposed to, because of the kind of electromagnetic waves it's exposed to. Then you have the kind of prescription drugs that you have, the alcohol that you have that impair your liver. Those are the toxins that enter your liver. Then, of course, all the viruses and fungi and parasites that accumulate everywhere and accumulate in your body. Heavy metals diminish neurological function. And this is the most important thing that I need you to understand. It causes decreased neurological function, causes lower bone density, but most importantly, it causes IHD, that is ischemic heart disease, coronary artery disease, and cardiovascular disease as well, besides peripheral vascular disease. Please understand, heavy metals is one thing that affects you so badly. 25,000 patients and counting, we have been able to detoxify people of these heavy metals and reverse their heart conditions. Please understand this. I still do it. I have tons of patients and we have fantastic results because we concentrate on this one fact, besides other things that have come. But this happens to be one of our primary motives because we see this in normal blood tests. We can look at it and say, okay, this patient has a problem. We need to detoxify him. We need to put his nutrition together. We may need to balance his hormones, or we may not need to balance his hormones. But these two we need to do desperately, and then look at the other three after that. So chelation therapy, which we use for detoxifying you of heavy metals, is always an ongoing process. And I will discuss this more when we talk of detoxification in the detoxification webinar. But today, I'm just going to mention it to you. It's an ongoing treatment. It will keep you healthy as long as you want to remain healthy. And that's the one big advantage of this. Yeah. I want to just give you some evidence as far as heart disease is concerned. This was a study that came out in 2013. Incidentally, chelation therapy is the only way of heart disease treatment which has a study which proves that it works. People say that there is no study, it is all humbug. This was done by the American Heart Association themselves, where in stable patients with history of myocardial infarction, that is heart attack, the use of intravenous EDTA chelation regimen with disodium EDTA compared with placebo modestly reduced the risk of composite or adverse cardiovascular outcomes, many of which were revascularization procedures. This was published in no less than Journal of American Medical Association on March 27, 2013. I just put one study. There are tons which have come out from this one major study, which was done over a span of 10 years, 12 years. But the best commentary on that was written by Dr. Harlan Krumholz. He was the professor of medicine and epidemiology at the public health at the Yale University, one of the biggest universities of medicine in America. And he speaks, the irony is that if the drug manufacturer had gotten this result, they would have celebrated. We have billion-dollar drugs like niacin and fenofibrate and ezetimibe, which many of you must be taking, that have less evidence than chelation has now. None of these drugs has contemporary outcome studies that show benefit. And in fact, two of them, niacin and fenofibrate, have two recently negative trials. Despite it, they are continuing. Unfortunately, despite the evidence, chelation does not happen to be the mainstream treatment of choice for cardiac disease, but we've been using it to detoxify our patients and reverse the disease as far as possible and give them the best quality of health going forward. Finally, I'm coming to balancing the mind and the body, the last two components of this jigsaw puzzle of restoring our health. So in restorative medicine, one of the most powerful interventions is the mind and the body. There is tons of scientific evidence that is mounting day by day that shows that the powerful effects of the mind and the body in functions, in body functions of repair, maintenance, and prevention of age-related issues. Every disease has been associated with stress of the mind. And my dear friends, let me tell you something. I have seen my patients recover well if they have their mind well balanced. If their mind is not well balanced, if the stress persists, they deteriorate very fast. The older they are, the worse they get, despite all your interventions. And that's why many patients don't do well when they have home stress of their family and etc. etc. The every body process is associated with the stress of mind. Energy produced by a mental intention which can produce change at the level of the cell. So you need to understand that today there is a whole lot of something known as quantum medicine that is going on, which talks of how just thinking about a disease can change the way the disease outcome is. If you're positive and you know that you can get rid of the disease and you're confident and you think that way, everything that works in that direction will work. The kind of neurotransmitters the brain releases, and this has been proved, is different. If you're stressed, you're scared of the disease, you get only worse because the kind of neurotransmitters you get from your brain are different. So the mind and the body must be addressed properly and thoroughly if you want good optimal health. So what happens generally in the morning every day, we go to office like this, and by the middle of the day, this is what is our state. And by the end of the day, we are so stressed out that we feel like dumping everything and getting out. You have to set the intention to achieve the best health and peace in all that you do. You need to take care of yourself first and honor your own needs first. Only then you can take care of others. Most important. Number two, always practice some amount of mental exercise, that is yoga, tai chi, qigong, these and regular breathing exercises that you need to do. They have been shown to decrease cancer, heart disease and cognitive decline by more than 30%. So just imagine what are your chances of not getting it if you're regularly doing some yoga, some exercise and some breathing exercise. In fact, one of the common things I tell my patients to do is that if you get stressed, either go out there and laugh or go out there and actually do some deep breathing exercises, because these deep breathing exercises are going to decrease the stress levels. And when you decrease your stress levels, you are going to start seeing different neurotransmitters coming out. Yeah. So this is step number two. Step number three, or tip number three that I have, is go for hydrotherapy baths with Epsom salt. What are Epsom salts? It's magnesium salts. So if you put magnesium salts in a bathtub and go for a bath twice or thrice a week, your pressure levels will come down because of the amount of magnesium that gets absorbed in your skin. Also, it's a very calming therapy. Lots of hydrotherapy calms the mind because the huge amount of magnesium that gets into your body. The other one is a good massage. So you need to pamper yourself also. You just can't think of working hard, because if you don't pamper that body of yours, that body is going to give way. My dear friends, we take care of our cars, we take care of our vehicles, we take them for regular servicing. Why can't we do it with our bodies? Think about it. Finally, you need to practice conscious breathing every day, at least 5 to 10 minutes. Close your eyes and do some deep breathing exercises. This relaxes everything. Your muscles, your brain, your cortisol levels come down, your good neurotransmitters, serotonin and others come, which oxytocin, serotonin are released. You feel good, you feel very invigorated, and you are able to take on the world come what may. This is one of those studies that has been shown that if you do transcendental meditation, there is reversal of atherosclerosis, so decreased blood pressure, there is reversal of heart disease, there is reversal of insurance claims which were made because of heart disease. And most of all, this study showed that there is reduced mortality in people who do transcendental meditation. This is a study that has been published. I just put it out for yourself. Now, when you want to maintain a strong body, we've come to strong mind, now strong body, you need to exercise regularly. Now, exercise has always to be within the cardiac limits of tolerance. Are we getting this? Within the cardiac limits of tolerance. Preferably 3 to 4 aerobic sessions per week of 20 minutes each, and 2 to 3 sessions of non-aerobic exercises. Now, let's look at what are these aerobic exercises. Now, when you look at aerobic exercises, if you are not taking any cardiac drugs, this equation works for you. Look at your maximum heartbeat minus 120. So your maximum heartbeat, minus 220. You take 220 and you minus your age from it. So a 60-year-old patient, If you minus it from 220, you will get your maximum heartbeat. Your maximum heartbeat should be 160. If it is more than that, you are overdoing it. You have to keep it around that much or 3/4 of that. Okay, so the maximum heart rate you should be is at one is 220 minus your age. Now this does not work if you are taking any cardiac drug. No cardiac drug will allow you to do this calculation. This calculation goes out if you're taking a cardiac drug. So ideally what I tell my patients is don't get into this checking your blood, checking your heart rates, because today everybody has got these Fitbits. Everybody wants to check their heart rate. They want to do this, they want to do that. It may not be working out for you that way. That's not the best way to do exercise. The easiest and the best way to do aerobic exercise is do interval training. Simple. Get onto an exercise cycle, 2 minutes of slow cycling, 15 seconds of fast, 45 seconds slow, next 5 to 8 minutes, more than enough of exercise. This becomes a very regular exercise. 15 seconds fast, 45 seconds slow. 15 seconds fast, 45 seconds slow. You do it for 5 minutes or 8 minutes beyond the slow cycling of 2.5 minutes that you do. This is enough for you to do an aerobic exercise. Anaerobic exercise is weight training. You need to do light weights, not heavy weights. Excellent for cardiovascular fitness. Again, the ideal thing that you need to do is what is known as circuit training. Now, circuit training is you do it about you do 2 times a week or 4 times a week. What you generally do is you do upper arms or lower arms on a given day. If you do upper arms on a given day, do three sets of exercise, light weights, fast. So you do 10 curls, 10 triceps, and then 10 maybe your deltoids or your shoulder, and one after the other without a break. Give a 30 seconds break. Again, repeat those 3 exercises, give a 30-second break. So you have 3 sets with 30 seconds break in between. That's it. So your entire exercise schedule finishes in 20 minutes if you go to a gym. If you have got your entire weights at home, these light weights at home, you will be able to do it at home with no issues. Then you need to do a little bit of stretching and flexibility, because that helps you to reduce chances of injury. And it also helps you to relax. So yoga is a good way of doing it, but general stretching is something that you need to do before and after your exercise. So the key word, my dear friends, is whether it's raining, snowing, whether it's cold or hot, you need to do some amount of exercise. So the discipline has to be, whether it is indoors or outdoors, you will do exercise like you go to the toilet every day. That is the kind of discipline you have to have. So in conclusion, as we conclude, we're about 5 minutes away from 6:30. With the knowledge that we will live longer than those before us comes the quest to live better than those before us. Will we be in a chair with scarce recollection of our past, or will we be walking, talking, energetic and happy? I'm asking you this question with which I started the session today. My dear friends, we are standing at the threshold of a new paradigm. For the first time, we can apply advanced technologies for very early detection, prevention, and reversal of age-related disorders. So when we realize only 4% of breast cancer is accounted for by breast cancer genes, please understand this, and less than 50% of heart attacks occur with those with high cholesterol levels. My dear friend, it becomes crystal clear that these conditions are results of preventable imbalances in hormones, nutrients, toxins, the mind and the body. And if you do this, and when you correct this, the reality is that the body returns to its optimum functional state, and you reverse your problems and restore your health. So whether you call it anti-aging or regenerative or restorative medicine, this is evidence-based medicine. It is the only way forward to restore towards complete restoration of your health and your complete wellness. With that, my dear friends, I'd like to thank you